This training program will highlight the different areas of the HIPAA law, including overview, what is HIPAA, covered entities, disclosure of protected health information, notice of privacy practices, patients' rights, business associates, administrative safeguards, safeguards for security, physical safeguards for security, technical safeguards for security, breach notifications, compliance and enforcement. Overview. What is HIPAA? In August of 1996, Congress enacted the Health Insurance Portability and Accountability Act, also known as HIPAA. Additional legislation was added with the Privacy Rule of 2000, the Security Rule of 2003, the Health Information Technology for Economic and Clinical Health Act, HITECH, and the American Recovery and Reinvestment Act of 2009, and the Omnibus Final Rule of 2013. The primary purposes of HIPAA are to protect people from losing their health insurance if they change jobs or have pre-existing health conditions, to reduce the cost and administrative burdens of healthcare by creating standard electronic formats for many administrative transactions that are currently carried out on paper, and to develop standards and requirements to protect the privacy and safeguarding of personal health information. The HIPAA privacy and security rules state a covered entity must train all members of its workforce on the policies and procedures with respect to protected healthcare information. Training must be documented to show it was completed and must be provided within a reasonable period of time to all new employees after the person joins the covered entity's workforce, and each employee of the covered entity's workforce whose functions are affected by a material change in the policies or procedures of HIPAA. The Privacy Rule and the Security Rule regulations require healthcare organizations to adopt processes and procedures to ensure the highest degree of patient confidentiality. These processes include administrative, physical, and technical safeguards to ensure that medical information is stored, transmitted, and received in a safe and secure manner, and to assure patient confidentiality. HIPAA regulations cover a broad scope and impact virtually every department of every entity that has access to personal health information. When covered entities use or transmit protected health information in any form, including electronic, they must not only comply with the privacy and security rules, but also with any state laws regarding the privacy of medical records. In the event of a conflict between HIPAA and state law, HIPAA preempts and supersedes state law unless the state law is stricter. In other words, whichever is stricter and provides a patient greater protection, it must be followed. Covered entities. A covered entity is any entity which creates healthcare information or uses healthcare data for providing healthcare, payment for healthcare, or performs healthcare operations and conducts healthcare transactions electronically. Examples of covered entities include healthcare plans, healthcare providers such as hospitals and medical practitioners, healthcare clearinghouses, and business associates of covered entities, which include auditors, consultants, lawyers, data and billing firms, accountants, bookkeepers, and others with whom the covered entities have agreements involving the use of protected health information. Covered entities are covered by the privacy and security rules and must comply with HIPAA. Disclosure of protected health information. The privacy and security rules protect individually identifiable health information transmitted or maintained by a covered entity, no matter what form it takes. For example, when a doctor takes notes on a medical chart, when a hospital data entry clerk types health insurance information into a computer, or when healthcare providers discuss a patient's condition, any identifiable health information becomes protected health information, PHI, under HIPAA. A covered entity may not use or disclose protected health information except if an individual authorizes release in writing or if the HIPAA privacy rules permit or require. HIPAA privacy rules allow the use and disclosure of protected health information without an individual's authorization for the following purposes or situations: to the individual or their authorized representative, for treatment, payment, or healthcare operations, when the individual has the opportunity to agree or object, such as when a patient brings another person into the exam room for their office visit, incidental to an otherwise permitted use, and for purposes of research or public health. Generally, a covered entity may not use or disclose protected health information for purposes other than treatment, payment, and healthcare operations without the patient's written authorization. The privacy rule does allow incidental disclosures of PHI as long as the covered entity uses reasonable safeguards and adheres to the minimum necessary standard. For example, doctors' offices may use waiting room sign-in sheets. Hospitals may keep charts at bedside. Doctors may talk to patients in semi-private rooms, and medical staff may confer at the nurse's station without violating the privacy rule, as long as reasonable safeguards are followed when using or disclosing PHI, or when requesting PHI from another covered entity. A covered entity must make reasonable efforts to limit PHI to the minimum necessary to accomplish the intended purposes of the use or disclosure. Covered entities should rely on professional ethics and best judgments in deciding which of these permissive uses of PHI and disclosures to make. Notice of privacy practices. The privacy rule requires all covered entities to provide patients with a notice of privacy practices and to make a good faith effort to obtain a patient's written acknowledgement of receiving the notice of privacy practices. The notice of privacy practices must inform patients of the uses and disclosures of PHI that the entity may make, inform them of their right to access and amend their medical information, and inform them of the covered entity's responsibilities with respect to PHI. Once it has obtained the signed written acknowledgement or has made a good faith effort to do so, the entity may use PHI for its own treatment, payment, or healthcare operations, and disclose the PHI to other covered entities for their treatment, payment, or certain limited healthcare operations. Patients' rights. HIPAA gives individuals rights over their health information, including the right to get a copy of their information, to make sure it is correct, and to know who has seen it. It is important for covered entities and business associates to understand those rights and what their obligations are in regard to patients' rights. Except in certain circumstances, individuals have the right to review and obtain a copy of their PHI. Covered entities may impose reasonable, cost-based fees for the cost of copying and postage for information requests. In most cases, covered entities are required to provide the information to patients within 30 days. Personal representatives, parents of minors, and others may be legally authorized to make healthcare decisions on behalf of patients. These individuals should be treated with the same respect and information access as the individual. Individuals can ask covered entities to change any wrong information stated in their files or add information if they think something is missing or incomplete. Even if the covered entity believes the information is correct, they must still document the individual's disagreement concerning the information, and their file should be updated within 60 days. Individuals can request to know how the covered entity is using their information and if it has been shared with any business associate. Individuals can request their information not be shared with certain groups, people, or companies. Individuals can ask for other restrictions as well, but covered entities do not always have to abide by these requests if they believe it could affect their care. Individuals can also ask the healthcare provider or pharmacy not to inform their health insurance company about care they receive or drugs they take. This is provided they pay for the care or drugs in full, and the provider or pharmacy does not need to get paid or reimbursed by the individual's insurance company. Business associates. The privacy rule allows covered providers and health plans to disclose protected information to certain associates. These business associates of covered entities include auditors, consultants, accountants, bookkeepers, lawyers, data and billing firms, and others with whom the covered entities have agreements involving the use of PHI. Business associates must also train their employees on HIPAA requirements. The Health Information Technology for Economic and Clinical Health Act, or HITECH Act, extends the same legal requirements to business associates to protect PHI, detect breaches, and report violations of HIPAA to their covered entities. Administrative safeguards. Since many employees receive, store, and transmit PHI as part of their day-to-day responsibilities, the privacy rule requires administrative safeguards to ensure that PHI is not compromised. The entity must designate a privacy officer to be responsible for the development and implementation of privacy policies and the receiving of complaints. The entity must train all workforce members on privacy policies and procedures, when necessary and appropriate, for them to carry out their job function. Finally, the entity must develop a system to track who accessed what information and implement rules for addressing violations of privacy, security, and transaction regulations. This should include establishing a process for making complaints and preventing retaliation against anyone who reports a HIPAA violation. Safeguards for security. The HIPAA security rule requires administrative, physical, and technical safeguards for covered entities and their business associates. The entities and business associates must implement safeguards to protect electronic PHI, ePHI, confidentiality, integrity, and availability. Covered entities and business associates must develop and implement reasonable and appropriate security measures through policies and procedures to protect the security of ePHI they create, receive, maintain, or transmit. What is reasonable and appropriate depends on the nature of the entity's business, as well as its size, complexity, and resources. Covered entities must review and modify security measures to continue protecting ePHI in a changing environment. Security requirements include designating a security officer to be responsible for the development, implementation, and evaluations of security policies. This may be the same person as the privacy officer. As part of a security safeguard, a technical evaluation and implementation of procedures to ensure that the entity's computers are secure from intrusion is required. The entity must apply appropriate sanctions against employees who fail to comply with HIPAA policies and procedures. Entities will implement procedures to regularly review records of information, system activity, such as audit logs, access reports, and security incident tracking reports, and develop a plan for granting and limiting different levels of access to ePHI, including clearance procedures and termination procedures. This includes security checks and special training for all employees with access to sensitive information. It is important that all employees understand how to keep ePHI secure and report any incidents regarding ePHI. Employees should also understand the importance of password security, computer virus protection, and the dangers of malicious software and phishing emails. The entity must also implement a contingency plan for responding to system emergencies, including the performance of backups, emergency mode operations, and disaster recovery procedures. Finally, entities need detailed instructions for reporting and dealing with security breaches. Physical safeguards for security. The security rule also requires a number of physical steps to ensure that ePHI contained in computers is properly protected from environmental hazards, as well as from unauthorized intrusion. Physical safeguards include developing a facility security plan that deters intruders from access environments where sensitive information resides, guidelines on workstation use and security describing the proper functions to be performed on computers, and how to handle sensitive information that may be displayed on computer screens. The entity must have a set of procedures that govern the receipt and removal of hardware and software, such as disks, memory sticks, laptops, and PDAs, as well as procedures for off-site data backup. Technical safeguards for security. The security rule requires certain technical safeguards for PHI, which include controls to ensure that access to sensitive information is available on a need-to-know basis based on user responsibilities. The entity must have audit controls to record and examine system activity, helping to eliminate unnecessary access to sensitive information, and data authentication controls to help ensure health data has not been altered in an unauthorized manner. HIPAA requires individual person or entity authentication controls to ensure data is sent to the intended recipient and received by the intended party. These controls include the use of password protections, PIN numbers, and, when sent over public networks, encryption. According to the security rule, it is permissible to use the Internet to transmit PHI via email and fax, as long as an acceptable method of encryption is used to protect confidentiality and appropriate authentication procedures are followed to ensure correct identification of the sender and receiver. Although faxes are transmitted over telephone lines, they are not considered to be covered transactions by the security rule. However, faxes may be sent as authorized by your company's privacy policy. Breach notifications. The HITECH Act also brought about the breach notification rule, requiring covered entities to notify affected individuals, the Department of Health and Human Services, and in some cases the media, of a breach of unsecured PHI. Generally, a breach is an impermissible use or disclosure under the privacy rule that compromises the security or privacy of PHI. The impermissible use or disclosure of PHI is presumed to be a breach unless one can demonstrate there is a low probability the PHI has been compromised based on a risk assessment of at least the following factors: the nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification. The risk assessment must also evaluate the unauthorized person who used the PHI or to whom the disclosure was made. It must be determined whether the PHI was actually acquired or viewed, and to what extent to which the risk of the PHI has been mitigated. Most notifications must be provided without unreasonable delay and no later than 60 days following the breach discovery. Notifications of smaller breaches affecting fewer than 500 individuals may be submitted to the Department of Health and Human Services annually. The breach notification rule also requires business associates of covered entities to notify the covered entity of breaches at or by the business associate. Compliance and enforcement. Failure to comply with the HIPAA privacy or security rules can lead to significant financial and other penalties. Civil and criminal penalties to both individuals and companies may be enforced. Fines for HIPAA noncompliance can be up to $1.5 million per violation category per year. Personal fines of up to $250,000 can be imposed if an individual violates HIPAA and it is found there was malicious intent behind their actions. Jail sentences of up to 10 years can be imposed on individuals in cases deemed sufficiently severe. Conclusion: the HIPAA law and security rules are designed to protect the individual from unauthorized use of information regarding their health. Malicious use of information received and/or viewed by entities or their employees can result in severe penalties. It is important that you and your company follow the HIPAA directive.